NHS data. Thankfully, in the last couple of days, the government postponed the opt-out from NHS data, which they put forward all these different ideas on the government website, using civil servants, it has to be said, to persuade people to allow their GPs and the NHS more generally to share their data. Where it's going to be shared to, of course, is rather nebulous. They probably would argue it's not nebulous, but the fact that when you look on their website, it does certainly appear to be an obfuscation, shall we say? It's generalized terms that they've, for example, like research, planning, the intention of using the data to help us to avoid another epidemic, but they're not specific at all in what that means. And for many people, there's a sort of a suspicion that actually this data will be sold by the UK government. So our data will be sold by a Tory government to American insurance companies, who will then use that data to contact people individually, to develop policy structures in the future along lines of a privatized health service in this country that will not be beneficial to the most people in this country, as we can see from the United States. The United States obviously is a classic example, isn't it, Tom, of how so many people, tens and tens of millions of people, are left out pretty much from receiving even adequate healthcare. So it's a massive concern,
And just for the viewers, for those that don't know, I mean, I'm sure everyone knows how horrendous the American system is, but the average cost of health insurance per person in the United States is around the $5,000 mark, so roughly £4,000. Family of four, £16,000 per year for health insurance cover that often doesn't cover everything. That still includes payments to be made by you. It doesn't cover all the costs. There's still co-payments and deductibles, and various illnesses that suddenly people fall ill and find that particular illness is not part of the cover. The number one cause of bankruptcy, personal bankruptcy in America is due to medical bills. Really shocking. I forget the figures, but I think it was, I think millions of people now have gone bankrupt in America due to unpaid medical bills over the last, say, 10 years.
And of course, they are the middle classes, aren't they? They're the middle classes who can actually afford it. There's 40 to 50 million people in America who can't even afford that insurance. And when people study life expectancy in the United States, it's no surprise that the people who can't afford insurance are dying a lot earlier.
Yeah, it's despicable, and I'm sure another time we'll talk about why America is now a pretty much a failed society in any sort of measure of society, but certainly lack of access to healthcare, massive wealth inequality, and the lack of access, associated lack of access to healthcare is certainly one of the major indicators of a society that's just not working.
And there's some frightening videos on YouTube that show private ambulances dumping patients outside of hospitals. They arrive at a hospital, they're asked if they've got insurance, they haven't got the insurance. So what they tend to do then is, this is often people, for example, who are living on the streets, they then take them in a private ambulance and take them to a hospital that is much more, let's say, sympathetic to dealing with non-insurance based patients, and just dumping them outside and driving off.
Yeah.
And you've got these CCTV cameras, obviously the recordings shown on YouTube of these people sometimes who don't know where they are. They're wandering around aimlessly in a nightgown outside the hospital, and until then people come out and take them inside. This is supposed to be, one of the most civilized places on the planet, and yet it's far from civilized in terms of what so many bureaucrats and corporate profiteers are actually doing.
It's shocking and it's brutal, and it's deadly, the system. And for those that have seen, there's been various extraordinary, fabulous documentaries about, showing that how appalling the system is in America. And John Pilger's documentary made a couple of 2-3 years ago,
Yes.
showed extraordinary scenes. This charity that runs whole days or several days at a time, where people without insurance can go and for free get medical and dental attention and treatment. And there's people camping for days in a queue to access that. Huge numbers of poor people that just can't afford medical cover and don't get treatment, and they have to queue up for days to get this charity healthcare if they're lucky, and travel hundreds and hundreds of miles to access it. So yeah, really eye-opening and shocking. And don't for a minute think that isn't the aim. Some people think, well, that's America, and by the way, the American system costs 2.5 times per person per capita. It's 2.5 times more expensive overall than any other system in any sort of developed country. So massively expensive. And the reason it's massively expensive is there are vast profits, of course, going to the insurance companies and their rich shareholders and big pharma and their shareholders, etc.
Of course,
But
but the
don't for
other
a minute think that can't happen here, because it's very clear that selling off whole swathes of our NHS to to private interests, particularly from America, is very much central to the government's agenda.
But the other major reason, Tom, I think well, certainly just as substantial, is the fact that whenever insurance companies are involved, as we've seen, for example, with motor vehicles, is that the actual amount that the customer is charged if they're claiming from the insurance is considerably more than it would be if it wasn't. Because with insurance companies, is this on insurance, wherever it might be, they stick another 100 quid on top. So that's why
add a zero.
Exactly. That's why it's so inefficient, because it's costing so much more, because people take advantage of the fact that it's an insurance-based scheme.
Yeah.
But coming back to the data, please, viewers, do your own research. Go onto the government website, and if you believe them, fine. But if you don't believe them, you can contact your GP by clicking on, click on the link. You can contact your GP. They should be messaging you. I know, for example, that local people around here have received texts in the last few days from their surgeries, still based on the premise that the opt-out is in June. Of course, now it's been suspended until the 1st of September. But contact your GP if you don't trust the government, if you don't trust them with what they're going to do with this data. And all you've got to do is just inform your GP that you don't want your data shared. And that way, these private companies in the future will not get their hands on your data and be able to exploit you and it behind your back.
And it's worth adding that there is a form. There's actually 2 forms. There's one for your GP, and there's one that if you're online, you can go on NHS digital website and opt out. And there's a need to do both. If you want to opt out, my understanding at the moment is that you should do both. Yes. Because they're 2 separate entities. So fill in a form, hand it into your GP practice, and by the date in September now, and also go on the NHS digital site and opt out on there. And people can find links from the article there on Dorset Eye. And it's fascinating that the government have asserted that they are not going to sell our GP records. However, they do say that there may be a transaction where our GP records are given to private companies, which obviously will mostly be American healthcare companies. And as part of that transaction, there may be money flowing in the other direction. So they go, no, we're not selling it. No, we're just giving it away, and we might get some money back for it to the Conservative Party. Of course, they don't have to directly sell it they can give it away, and in return, that they can simultaneously give vast contracts using our public money to these private companies, as they have been doing throughout the pandemic. And those private companies may have links to the Conservative Party. They may donate large sums of money back to the Conservative Party or to individuals such as Boris Johnson. So, it's a roundabout of corruption, and the words they use to hide that are, to be scoffed at by anyone with any sanity.
No, and again, our advice is to viewers: do your own research, find out for yourselves. But if you decide that you don't trust the government, don't wait to the 1st of December. You've got now the rest of June, July, and August to fill out these forms. Even if it takes a couple of minutes to do so, protect yourself.
Yeah, and we are talking here about all our records. So your whole medical history, your illnesses, your medications, your sexuality, your sexual history, your mental health history, all of that for your whole family. Is what we're talking about being given to private companies. And of course, one of the reasons why that information is so valuable is that if we consider that we may be moving towards an American privatized model with health insurance in the future, which of course the Conservatives deny, but I think that's very likely to be what the direction that they're heading. All the evidence suggests that's the direction they're heading. That information is really valuable, particularly to health insurance companies, because they will base decisions on your medical history. That's what they use to base their decisions about how much premiums they're going to charge you. So if you're unbelievably healthy and have hardly ever suffered with any illness in your life, your premiums will be cheaper. If you've had a number of illnesses, or even perhaps a permanent illness or sort of disability that requires medical treatment, your premiums will of course be astronomical. And they use that information to determine those premiums.
And of course, a couple of things to finish off this slot. But firstly, again, readers, viewers, do some research in terms of the number of GP surgeries that are being handed over to American insurance companies already. That is a massive issue. But of course, also is the development of the DNA trackers. So if they're doing a lot of, information will be coming from our DNA in future as they progress scientifically, they'll be able to tell what we're susceptible in terms of hereditary illnesses too. And that also will determine the premium that we're going to be charged from a very early age. We won't have any control over it. They'll just say, oh, we've looked through your DNA. We can trace it back 2 or 3 generations and we find that there's a history of heart disease. Unfortunately, that's going to mean that your premium's pushed up by X number of pounds. And there's nothing we can do about it. And that's what's happening, or will happen, across the world where we allow private healthcare to take over. So again, like many other topics, I'm sure we'll be back on this one soon, Tom.
And just finally on that's where the concept, the socialist concept on which the NHS was founded, is crucial there, because it's the concept of pooling the risk rather than individuals having low risk or high risk and paying associated premiums or not being able to afford healthcare at all. The idea with the NHS is that the risk is pooled. Some people are low risk, some people are high risk, some people require lots of hospital treatment and medication, others require very little. And the idea is that that risk is pooled, and we all look after each other, and everyone's equal, and everyone gets treatment free at the point of delivery through our NHS. Something we have to fight for to hold on to.
Yep, and Nye Bevan, I can see on my t-shirt, he was there at the beginning.